COVID-19. Before we start, please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Again, thank you for joining us this morning. As you know, COVID-19 is on the rise in our community, and some very valuable information we passed on to you this morning. And again, thank you for being with us. We'll start this morning's updates with our community leaders. And first, we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor, if you'll give me one moment here.
Thank you, Chief. Today I have a lot of comments. We've got some graphs we want to show you here in a minute, but I would begin by saying before we had the vaccine, we all were fearful. We all were grieving. Because there was no vaccine, all we could do to protect ourselves was basically to follow the safety precautions which we all became familiar with. I naively thought once we had a vaccine that the virus would be vanquished. I've been disappointed and somewhat angered by the low level of cooperation, individuals in the community who have decided to take advantage of the vaccine. Fortunately, we're seeing some improvement in that in recent weeks. Some numbers from a meeting of the Dougherty County Health Department on June 14th. The numbers for the state of Georgia were 32% of our population had been fully vaccinated. 41% of the population had at least one dose. Now, as of August 18th, 2 months later, the number of Georgia residents who are fully vaccinated has increased to 42%, and those who have at least one dose has increased to 49%. This, as you will see hopefully in some graphs today, has not been a gradual increase. There has actually been a dramatic increase corresponding with this fourth surge of the virus. In a meeting, and I think Ms. Banks explained that to the public, of the task force, the Strive for 75. There is a marketing committee of the task force which came together. It's been explained to you. The objective is to have 75% of the county's residents vaccinated within 75 days of launching the campaign, which would be October 27th, 2020. That is a very ambitious goal. The members of this committee, one gentleman made a profound observation that anyone who is going to be vaccinated to protect other people was vaccinated months ago. And if we come up here and tell you, you need to vaccinate, you need to be vaccinated to protect your loved ones and others, well, that is a tired and futile message. This gentleman pointed out the only way to increase vaccine uptake is to convince those people who are reluctant to have the vaccine that it is in their self-interest to do so. The Strive for 75 campaign will be directing its message to various groups. And I'm not involved, but I can say that we know very few young adults have taken advantage of the opportunity to be vaccinated. There will be a presence on social media. And the Strive for 75 campaign will hopefully include clergy and other influencers. We need to coordinate with the public. We have resources. These mobile units are available. I see people upset because the mobile units aren't dispatched. Well, We have to have locations. These events have to be organized. And I would respectfully submit that members of the community, civic groups, if you want to get involved, contact the task force, and we would be more than happy to coordinate a on-site vaccination with you. I talked generally about those numbers, and I want to say I was moved a couple of weeks ago when Dr. Black was up here. And I think that many of us have been somewhat less compassionate that people are being sick in the last few months who have not been vaccinated. And that comes from our frustration. But when I saw Dr. Black talk about this individual that he knew, he had actually discussed and encouraged that person to have the vaccine several times. She was hospitalized and did not survive. Dr. Black was struggling to hold back the tears. This was someone he knew. He's a healthcare provider. He has dedicated his life to protecting others. And it is frustrating when we see people who are not protecting themselves. There's something, I guess, one of the physicians will discuss it, but I want to mention it, and I hope I pronounce it right. It's called monoclonal antibody theory. You'll hear more about it later on today. But what this is, as I understand it, there's an opportunity to have an infusion of antibodies for those individuals who have not been vaccinated within a window, a few-day window of becoming symptomatic. And it's my understanding that this therapy has been very effective in impeding the progression of the disease. In other words, people who have not been vaccinated and test positive have the chance to minimize the impact of the disease. What everyone needs to do, if you have a friend or loved one who has not been vaccinated and is tested positive, he or she should be encouraged to contact their physician or contact the hospital to make arrangements to take advantage of this opportunity to minimize the impact of the virus upon them. As I said, studies, and it's proven that very few people are becoming seriously ill if they can have this therapy in time. Now, we have some graphs here today. I want to show, go through this. The testing results are every 2 weeks. What this is showing us is the number of tests in Dougherty County that have been performed and the positives. Okay, I'm sorry, and the positive results. What you see, this starts in January of this year, which goes back to December. We remember that we had a spike earlier this year. The number of tests is going to somewhat correspond to the prevalence of the virus, because the more people that are getting sick, more exposures, and more people are being tested. What you see here is the spike early in the year. It's sort of stabilized in March. It goes to late April, early May, and the numbers continually decline. You see this period between May 10th, the numbers are continually declining until we get to the end of June, and the numbers have spiked back up. The number of positives for the last reporting period, 870, is as high as any time since January of this year, and the healthcare community is virtually positive that that number is going to exceed the 897 in 2 more weeks. These are the results, the positivity rates. The 3 standards that we've discussed in recent meetings are the positivity rate, which we all know is the number of people, the percentage of people who are being tested who test positive for the virus. Another issue is what's called the 14-day rolling rate. and that is the percent, that's the number of people in the specific county per 100,000 population which are testing positive over that 2-week period. The third, which we have discussed, is the census, or the number of patients in the hospital. Here we see an extremely alarming figure. We go back to January 4th, when it was 17, 18, and then 14% positives. This number needs to be under 5% for the virus to be controlled. We see that the number declined, and here from March 15th all the way until July 5th, the positivity rate was under that 5% threshold. It spiked up suddenly in July and is now at 21%, which, as you see, is a higher percentage than it was early this year during what was called the third surge. This is just a graph showing the positivity rate, and again, we got up to 18% on August 2nd, and now we're at 21%, which is higher than it's been all year. Phoebe Putney Health Systems, and this is all 3 hospitals in the system, provided this information, and I'm appreciative. We see here the number of COVID patients in the 3 hospitals, Phoebe Putney, 4 Phoebe North, Phoebe Sumter, and Phoebe Worth. The dark blue is the number of patients who are in the ICU. And you'll hear from this later. We hear these numbers. I don't know what the threshold is, but I remember in the past that it was discussed, as long as we can keep under 40 patients, since COVID patients in-house, we can continue to operate the hospital in a normal fashion. I don't know if that's the exact number. I can be corrected. But more importantly, no, as importantly, is this dark blue. Those are the patients, number of patients who are in the ICU. As you see from, and this goes all the way back to March of last year. As you see, there were very few patients in the ICU from March until late June. And you see this spike right here in August. The county of residence, just for your information, this is the total cases. You see Daugherty, Lee, Sumter, Worth. We have our contiguous counties. Randolph is also served by Phoebe. One thing that is alarming is if you look at Lee County, the number of patients, and you look at Calhoun County, the number of patients seems to be, well, it is obviously lower than Daugherty County, but the percentage of their population being hospitalized is actually higher than Daugherty County. We see here an interesting trend. The percentage of the Caucasian patients has increased. Male, female has stayed the same. This is this last surge from July 15th. The age group, this is important. You'll hear about this. We've talked about it in recent weeks. The average age of the person who is being admitted is significantly lower than it was in the first and second and even the third surge. We are seeing, we heard from Phoebe Putney this week, and we heard from Daugherty EMS, apparently there are a number of pediatric patients, some 5 and younger, who are now testing positive and requiring hospitalization. These are numbers from Phoebe Putney here in Albany. Average COVID census by week. This is the number of patients, what they call in-house. As you see, again, we go back to March. It's sort of stable until May, when it starts dropping. It dropped continually. You know, we closed the EMA, we suspended the press conferences. Actually, I thought naively again that we were beyond COVID-19, and then in July we see this spike. But what is particularly concerning is the rapid rate of the spike. And this number of 108 is not going down. We heard from the medical community on Wednesday, and apparently with school resuming, students being exposed to each other in some counties, where they're not required to wear masks. The medical community is trying to monitor the number of people in quarantine in surrounding counties because that gives us an idea of where we're going. You see the 108, and I believe it's expected that Phoebe will soon surpass the number of patients in the hospital, the highest number per day. Dr. Hanson, tell us about that. Here, lastly, we've talked about the fact, and you hear some individuals say, well, people who are vaccinated are getting the virus. That's true. I'm not smart enough to understand it, and I got a little confused last night. I was trying to read. The researchers talk about the vaccine being, I think the word is attenuated, and basically what it means is over time, the vaccine is less effective against the virus. But the virus that is attacking the vaccine, and this is how it gets attacking the patient, is a stronger strain because it is mutated. And so it's conflicting, but the point is the number of individuals who are being admitted to the hospital is only a fraction. And this graph only goes back to April because that is a point in time where we had a sufficient number of people who had been fully vaccinated, and you could make this kind of determination. You see that, interestingly enough, from May to June, not one single patient who had been fully vaccinated was admitted, which indicates what? That the primary strain of COVID, the vaccine, was much more resistant. Then, when we start having the Delta variant, you see there are patients who have been fully vaccinated being admitted. However, it is very important to note that most people who are testing positive and who have been fully vaccinated are not becoming seriously ill. And I'll let the medical community talk to us about the third dose and what this portends, but be that as it may, we need to understand that being vaccinated is in our best interest. And again, not making a plea for your family or your neighbors, but you need to do what's right for yourself, and that involves being vaccinated. Thank you, Chief.
Mr. Mayor, thank you for really that very, very informative presentation. I think it's certainly needed at this time, and it was very timely to bring that information forward. So thank you, Mr. Mayor, for your remarks today. We will next move to hear from our representative from Phoebe Putney Memorial Hospital. Fortunate again to have Dr. Kathy Hudson with us today. She's the Chief Medical Officer for Phoebe Putney Memorial Hospital.
So today, we have more COVID-19 patients in our hospitals than we've ever had since the beginning of the pandemic. That's more than March or April of last year. We have 161 patients in Albany, 34 in Americus, and 4 in Sylvester. That's 199 patients hospitalized with COVID-19. That's a 50% increase from last week. Yesterday, we admitted 23 patients with COVID here in Albany. That is the highest daily total since April 9th, 2020. We've also had 7 COVID deaths in the past week. These are all very frightening numbers, but we have to remember that each one of these numbers represents a real person. Those are our friends and families in our community, and they're suffering and grieving. We have to keep them in our prayers and offer them support. Our hospital here in Albany is undergoing a code triage internal operations status as part of our disaster response policy. What that basically means is that any activity that is not critical for the operation and safe care of our patients is either being suspended or modified. This allows us to bring in extra patients, not patients, but extra staff to help care for patients or assign different duties than their usual activities. We've had great success in a incentive plan and a bonus plan to encourage our clinical workers to pick up extra shifts. And we've instituted a Helping Hands program where non-clinical personnel can come to the bedside and assist the clinical team by doing those non-clinical things such as running errands, helping them care for patients that does not require a clinical license, because we cannot continue to care for this volume of patients with our typical staffing. Every hospital in the Southwest and every hospital in Georgia is full. We are at capacity. We have not received a transfer in several weeks from another hospital, and we cannot transfer patients to another hospital. There are just no beds available. We need everyone to help us stop the spread of this pandemic. And what does that mean? It means get vaccinated. It means wear a mask. It means social distancing. If you have a large gathering scheduled, a football game, a church activity, a family reunion, if you must attend, please wear a mask. I know everyone has seen large groups of individuals out not wearing a mask. We have to do something to slow the spread of this virus. We continue to have breakthrough infections of vaccinated individuals, but 80 to 90% of those hospitalized are non-vaccinated. So the vaccine continues to be our best protection, and so if you're eligible, which means you're 12 or older, we encourage you to get vaccinated at this time. You can still continue to get vaccinated at Phoebe by calling 229-312-MyMD, that's 6963, to schedule a vaccine. There are also multiple vaccination centers throughout our area. You can also receive vaccination at our mobile wellness clinic by going to phoebehealth.com/mobile-wellness, or if you would like to schedule the mobile wellness clinic to come to your location and your event at church location, we'll be happy to assist in providing that opportunity. We have increased our monoclonal antibody therapy capabilities, and that again, as the mayor alluded to, if you test positive for COVID-19 and your symptoms are within the last 10 days, you are eligible for the COVID vaccine. So please ask your provider at the time that you're tested about receiving this, but you can also self-refer. If you did a home test or had a test at a site that did not have a provider, you can call 229-312-MyMD. The monoclonal antibodies have drastically reduced the severity of your illness if you are infected. It also prevents the progression to the severe disease which causes the hospitalization. And this is also available if you've been vaccinated and become infected with COVID-19. So please, if you've recently been tested for COVID-19, reach out to your provider, ask about the monoclonal antibodies. They are safe and effective. We desperately need everyone's help in our community to slow the spread of this disease. Getting vaccinations will help slow down the spread, which will prevent another dominant variant to emerge, because we are seeing this spread because of the Delta variant. We don't want another variant to come behind it that may be worse. So please, do your part, wear your mask, social distance, get vaccinated. Thank you.
Thank you, Dr. Hudson, for your remarks today. We will now hear from the Department of Public Health, Dr. Charles Lewis, who is the Director of the Southwest Georgia District, to provide some remarks.
Thank you, Chief. Good morning, everyone. Yesterday in the state of Georgia, there were approximately 10,000 new cases of COVID that were reported. In Dougherty County, we generally receive reports of about 50 to 55 new cases of COVID-19 every day among Dougherty County citizens. Over the past 14 days, we have received reports of 751 new cases. If you do the math and extrapolate that to 100,000 people, that comes to 853 new cases per 100,000 people, and that is a very high rate of spread throughout the community. That's cause for concern. If we look at some of the trends in the pandemic, recently we're seeing that younger people in general are getting the COVID infections, including children. Younger people, including children, are being hospitalized at a higher rate than what we were seeing in the earlier months of the pandemic, and that is alarming. Hospitals are stretched to the limit. COVID patients in the hospital consume an incredible amount of resources. It takes its toll on the people who work there, and they are all human beings, and they're tired. They remain compassionate and committed, but every human has their limit. So if you'll think about these cases of COVID in the hospital, our highest concern is certainly for the patients. But we need to recognize that there's a limit to what a hospital can do, and every hospital in Southwest Georgia is currently stretched. Now, you may be in the hospital already if you're hearing my voice, but most of the people within the sound of my voice are not currently in the hospital. But that could change for any of us tonight or tomorrow. Any of us may need the services of a hospital. And the more patients that have COVID and the more patients that have to go into the hospital, the harder it is for each hospital to provide essential services. So there are many reasons to get vaccinated. It's good for our own health. It's good for the community. It's good for our hospitals. When our hospitals have reached their limit, that's a dangerous situation for every man, woman, and child. In the state of Georgia, approximately half of the citizens have had at least one dose of the vaccine. 42% are fully vaccinated in the state of Georgia. In Dougherty County, 36% are fully vaccinated and 43% have had at least one shot. That's good, but it needs to be better. Vaccines are easy to obtain. There are many places to go. One source is public health. Every county in the state of Georgia has at least one health department, and every health department provides COVID vaccines. In Southwest Georgia, all of our 14 counties are offering all three vaccines, the Pfizer, the Moderna, and the Johnson & Johnson. The number for the Dougherty County Health Department is 229-638-6424. If you haven't been vaccinated, please call the health department or go someplace and get your vaccine as soon as you can. It can save lives. Now, we've never said the vaccine is perfect. When we started talking about the vaccine last winter, we said that the rate was somewhere around 85 to 95%, that it would protect people from infections. And 7 or 8 months later, that has proven to be true. It's not perfect, but it's the best thing that we have. I wear my seatbelt everywhere I go. Even if there was no law, I would wear it, because I know that seatbelts save lives. They don't work every time, but I know when I get behind the wheel, my best chance of surviving a crash is if I have my safety belt on. And I feel the same way about vaccines. I'm fully vaccinated. When I got my vaccines, I didn't have any misgivings that I would be protected 100%, but I knew that that was my best chance of avoiding a COVID infection. So please don't let that stop you. If the reason you're not getting the vaccine is because it's not perfect, please understand that that's the way it is with most medicines. That's the way it is with most medical interventions. It's rare that we can tell someone to take this medicine or undergo this form of treatment and it's a guarantee. There's always a chance that an intervention will not help or it will not turn out the way it was intended. But vaccines are the best way to control this COVID virus. I want to talk some about the third doses that are being offered. This is a very important situation, and it's important that we understand some of the details. We're not talking about boosters. The term booster, when we're talking about vaccines, we're talking about a vaccine treatment for people who have already been fully immunized. With most of our immunizations, over time, the effect will wane. And so in many cases, we offer and provide boosters to rev the immune system back up to a state of full immunity. What we're talking about using currently is third dose or additional doses for people whose immune systems are impaired to the point where they won't respond fully to the routine vaccinations. So for people who have a compromise in their immune system or a deficiency in their immune system to a moderate or severe degree, it is now believed that those people might benefit from an additional vaccine dose. So it's not really a booster, it's an additional dose. Currently, this is only available for people 12 years old and older who have had the messenger RNA vaccination. And the messenger RNA vaccines are the Pfizer and the Moderna. So if a person has a moderate to severe deficiency in their immune system, they are eligible for a third dose if they were originally vaccinated with Pfizer or Moderna. Currently, people who have had the Johnson & Johnson product are not yet eligible for an additional dose that may be coming down the road. So generally, people who have a moderate to severe deficiency of their immune system are going to know it. Generally, these are people who have doctors, there may be oncologists or rheumatologists, but generally, people are going to know it. Now, there are some specific guidelines, I think you may be able to see, if you can see on the screen. People who have malignancies, people who have cancer, who are undergoing treatment, generally are considered to be moderately or severely compromised in their immune system. People who are on immunosuppressant drugs. These are medications that people would take after doctors have explained to them that this may help your condition, but it may suppress your immune system. Some of those cases might include lupus or rheumatoid arthritis or Crohn's disease. Some of these medical conditions respond well to medications that will suppress a person's immune system, because many times their disorder is because of an immune system that has begun to attack their own body. So one way we treat that is to suppress the immune system. So people who are on these drugs generally have been thoroughly educated to know that they are on a drug that has some risks like this. Another category is people who have advanced HIV infections or HIV infections who are not being treated. That's not an exhaustive list, but those are some of the main categories of people who might have a moderate to severe compromise in their immune system. So if you're in that category, you are eligible for a third dose of Moderna or Pfizer if that's the vaccine that you had. If you come to the health department, we will ask you to sign a consent form. We will need to know specifically what your condition is that renders you immunocompromised. But that's all we need. If you have a note from your doctor that explains the details of your condition, that's even better. One thing I should mention is that if you are in this category, you have to wait 28 days after your vaccination has been complete. So if you've had your second Pfizer or your second Moderna, you're not eligible for the third dose until 28 days have passed. So that's a lot of information. It's a little bit tricky for lay people. So if you think you're in this category, I'd urge you to talk to your doctor, or if that's not possible, call the health department. We would be happy to help you work through this. We'd be happy to administer the vaccine if you're eligible for it. Let me say a word or two about boosters. It does appear that we will be able to offer boosters, true boosters, to people who have been fully vaccinated with normal immune systems. And it looks like September the 20th is the day that we're shooting for to start the boosters. Now, people will have to be 8 months beyond their last vaccination to qualify for the booster. So people who were vaccinated by January the 20th of this year should be eligible for a booster September the 20th. There are a lot of details that haven't been worked out that we will share with the public. We have not started making appointments for the boosters. We will start that probably probably September the 1st. We will start establishing those appointments, but the vaccines won't actually occur, the boosters won't actually occur until September the 20th and after. All right. We are very proud to talk about a great opportunity now for testing in Dougherty County. This is due to a partnership between the Department of Public Health, Phoebe Putney Memorial Hospital, and a company that goes by the name of LTS. This is a company that collects specimens and runs tests for COVID-19. They are in Albany as we speak. They are located over at Phoebe North, just behind the old hospital there on 13th Avenue. It's the same place where Phoebe Putney was doing the testing earlier in the pandemic. This testing is now 7 days a week. It started about 45 minutes ago. People are already going through the line. It's free. It's essentially the same as testing that you would receive most any other place. It's a PCR test. Results are expected within 24 to 48 hours. There will be a patient portal so that the patient can go online and check their own results and print the results off if they need to. We urge everyone to pre-register. That makes the process go much faster for everybody. There's a QR code. If you're able to see this, it's being displayed. This code is also on the public health website, Southwest Georgia Public Health. Today, tomorrow, and Sunday, the hours are 10 a.m. to 4 p.m. And beyond that, starting Monday, the hours will be 9 a.m. to 6 p.m. You can also call to pre-register, and that number is 844-778-2455. 844-778-2455. If you are symptomatic, we certainly want you to get tested and then isolate. Stay away from people until you get your result back. If you have symptoms but have a negative PCR test, then chances are you do not have COVID. So this is a great resource to have in Dougherty County. You do not have to be a Dougherty County citizen to have this test. As far as the district is concerned, we are making plans now to increase testing opportunities throughout all of our 14 counties. It does take some time to assemble staffs and make this possible, but we are working on it every day. So just remember, if you will, that actions have consequences, and sometimes a failure to act also leads to consequences that can be bad. We want to urge you, don't be a part of the problem, be a part of the solution. Make it better if you can.
Thank you, Dr. Ruiz, for your comments today and being with us and presenting on behalf of public health. We'd like to bring up now for our final presenter today, the Dougherty County Coroner, Mr. Michael Fowler.
Good morning. As a citizen in Dougherty County, many individuals want to say, they ask the question, what is the truth? Is people really dying? Is people really going to the hospital? I'm saying it's really true. People are definitely dying. And I want to take a moment to thank the faith-based leaders and the pastors for encouraging your congregation to get vaccinated. I mean, many of you have been very helpful. If we want to encourage you, try to get 100% of your congregation vaccinated. I've heard all kinds of reasons why many people say I'm not going to get vaccinated. It's the mark of the beast, it's the virus, and all kinds of things that come out. That is not true. That is not true. You have lost many family members, friends, co-workers, and before the vaccine came out. Now we have a vaccination that can help us. If you get vaccinated, now we have a vaccine that can help us. Why we don't take advantage of it, I don't know. My wife and my daughter work in the medical profession along with myself. We be around patients all the time that COVID positive. We have not been infected ourselves. So they're letting us know we're doing something right. All of us have had the vaccine, been vaccinated, and we are still alive. So something must be working right. As a pastor, I have not lost one of my members in my congregation since the virus came out. So something is working. So that's why I say, my pastors, you are so important in this community. If you can encourage your congregation to consider that. Once I was on a trip, and I was out on 75, my car started bumping, and I started having a problem when I had to pull off to the mechanic shop. I didn't know what was wrong with it because I'm not a mechanic. But I pulled off to the shop, and the man told me he can fix it, so I had to pay him. But I didn't know what the problem was, but I trust what he said. And what he did, I finally eventually got home. So it's the same thing. Why we don't trust the scientists? Why we don't trust the medical profession? When back last year, we was warned an answer. God had given us an answer and provided us an answer by the vaccine here, but many still have not taken it. Let me say, every day this week, I've been to a family house that have died from COVID. Every day this week, I've been to a family house. And then when I get to the house, many other family members are there saying they are positive too. This virus looks like it's a little bit more different from last year, because last year you go to a house, somebody was positive. One person might have been positive, and the rest of them, may go in quarantine. They was okay. But when you go to a house, I went to one house this week. It had at least 7 members in the house, and all of them was positive, and the one person was deceased. None of them had the mask on. So how many other people are they going to infect by going around other people? The schools are open now, and I'm fearful for the kids. My heart go out to them. I hope you take it serious that the kids wear masks, practice social distancing, do everything they possibly can, because I don't want to go to a small child and pronounce that child from dying from COVID. Before I came over here just then, a person died last night. Found out they had no medical condition. They had COVID. The wife had COVID. And she said that he would not go get tested. He would not go get the vaccine. So he died last night. There's help out there, but we got to reach out there and get it. Why are we not getting it? I got to trust the science. I plead, I beg, to ask you to consider, not only consider taking the vaccine, but do it. If not, I start putting back on my Tyvek suits now. When I go into a house, I'm putting on Tyvek suit, because it's so many. This thing is so easy to get compared to last year. I mean, last year we put on Tyvek suits and whatever, but right now it is so serious now. Monday, the mobile morgue will be here. I wonder who will be the first patient to go in that mobile morgue. Somebody said, Mr. Fowler, you're so insensitive. No, I'm for real, because I don't want you to die. I don't want to come pronounce you dead because of something that you could have prevented. I plead, I beg you again, consider, not only consider, but do it.
Thank you, Mr. Fowler. We'll do what we normally do. We'll pause here for any questions. No, he's not presenting today. Yes, thank you, though. Okay, what we'll do is we'll mention again the Strive for 75 campaign. Strive for 75 campaign is an effort to get 75% of our community vaccinated within 75 days. And you'll see some of the advertising material probably on your screen now. But it's very simple. Do your part. Do your part. And if you have not or decided not to get the vaccine, we ask in this campaign that you reconsider. Look at the facts. Look at the science that's out there. Listen to this presentation this morning. Call someone. Talk to someone about if you know that they've decided not to get the vaccine, to reconsider. And then finally, get the shot. Strive for 75 campaign. I asked Ms. Banks to share with me when this press conference will be available to be viewed by those people who are not able to watch it live today. She's informed me that as soon as our press conference ends, the recording will be available to be viewed on Facebook and I believe as well as YouTube as well. So Facebook and YouTube. Why do I mention that today? Today was full of information that can help people in this community, help you better understand the testing locations, how to get tested. We heard about boosters today. We heard about additional shots for those people who are at risk. So just quite a bit of information today passed along today, and I'd love for many more people than were able to view today to have a chance to take a look at the press conference today. We'll be back next week at 10 a.m. here. Our press conferences now will be weekly, and we ask that you please join us here at 10 a.m. on Fridays. If you have any questions about anything today, perhaps you missed a number or you missed someone that you'd like to reach out to, you can call us at the Emergency Operations Center. It is activated Monday through Friday from 8 a.m. to 5 p.m., 229-302-1900. I bid you a good day, and that concludes our press conference.